From the studios of KENW on the campus of Eastern New Mexico University, it's You Should Know, featuring the people and events of Eastern New Mexico and West Texas.
With me now is Arthur Garcia, and Arthur is the state director for the USDA rural development people in New Mexico, for the state of New Mexico. And also with me is Dr. Joanna Katzman, and Dr. Katzman is the director of the Pain Center at the University of New Mexico. And Dr. Katzman, I'm going to go ahead and say this. It's good to have a doctor in the state. It's great.
Thank you.
Really appreciate you taking your time to come and do this, and we hope that lots of people hear what we're going to talk about. What we'll talk about today is, first of all, addiction to opioids, and then we'll talk about what USDA is helping your organization, which is called ECHO, to do to help people that have this problem. First of all, let me just ask you, why is it such a problem getting addicted to pain relievers, to opioids?
Well, thank you so much, Don, first of all, for inviting me to be on the show with Mr. Garcia. It's really a pleasure. I'm really honored. Yeah. But it's really multifactorial why people all around the state and really all around the country are really suffering from substance use disorder. And what we're talking about today really is primarily opioid substance use disorder. You know, it's really a huge public health epidemic, why so many Americans, really on the order of 130 Americans a day, are dying from opioid overdose deaths, either from heroin or from prescription drugs. And many of them began really because they were in chronic pain, and they first started developing an addiction, opioid substance use disorder, from because they started down the road of chronic pain and were given prescriptions of opioid analgesics, and they became habituated to them and addicted, and it became out of control. And then many of those patients moved on to heroin if they could not get enough of the prescription medications. On the other hand, many people who became addicted in this country started on the pathway of intravenous heroin. There's also a third kind of route, in that luckily in New Mexico, we don't have a lot of illicit fentanyl and illicit kind of opioids. Primarily they're the fentanyl kind of medications. Many of them are coming from China these days, China and Mexico. But that's been kind of a killer for many, many Americans, especially in Appalachia and the northeastern part of this country.
Okay. I want to say a word or two to Arthur now, and then we'll get right back to you. But Arthur, you work with a government organization, and the U.S. government is really interested in solving this problem, aren't they?
Absolutely. Early on, we realized that this is an epidemic, and it has great deleterious effects on people's lives, our economy, all facets of American life. And so we at the federal government and USDA in particular are very dedicated to working with partners like Dr. Katzman to really address this problem, to bring all the resources to bear that we can to make sure that we eradicate this particular substance abuse disorder.
Okay. Well, Dr. Katzman, let's talk about what some of the problems for people, since we have rural development with us today, what some of the problems people have out in the rural communities. If they live right next to the pain center, maybe you have programs right there that'll help them with this. But what are some of the problems that, say, a doctor down in Hobbs or a doctor up in Clovis might have?
in the rural communities all around New Mexico and in rural communities all around the country, it's very hard for people to access primary care providers, access specialty care consultation. And so patients in chronic pain, patients with behavioral problems like anxiety or depression that might lead them to perhaps develop a substance use disorder, get the care that they need and deserve. And so sometimes it leads a patient going down the wrong track and develop an addiction that they might not have developed if they got the care in a timely manner. So that's really what can happen.
So you are working now to try to help doctors in these areas when they want to help the patient that's got pain, but they don't have all the information they need to help them use the pain reliever without getting addicted to it.
Right. And so a program that we developed at University of New Mexico is called Project ECHO, which stands for Extension for Community Healthcare Outcomes. And we create teams of interprofessional experts. So for instance, we have a program called Echo Pain and Opioid Management, where there's experts, we call it the hub, let's say at the University of New Mexico, that reach out to clinicians in all over the state, for instance, in Clovis and Portales and Hobbs and Carlsbad and Raton, various areas. And the clinicians can call in every week, for instance, like on a Thursday from 12 to 2, and present patients who need help that are suffering from substance use disorder or chronic pain, and we'll teach them, we'll guide them through the case, and so that they can better take care of their patient. And we'll teach them about things like safe opioid prescribing. We'll even help them be able to get their license to prescribe buprenorphine. Buprenorphine is one of the medications to control cravings, similar to methadone. And we'll also teach them about how to give naloxone. Naloxone is the antidote while someone is actually overdosing on prescription opioids or heroin or fentanyl. We try to get every person around the state to have naloxone in their home. So whether or not a family member or friend might have an overdose, maybe a stranger down the street, someone at the park might be overdosing. People should have naloxone available so that they can prevent and reverse an overdose. Naloxone is very safe to use.
You might walk next door and your neighbor would be in a trance,
Right.
so to speak.
Absolutely, Don. Absolutely, and you can save a life. It's one of the most safest medications out there.
Let me ask you: Do I need a prescription to get this?
That's an amazing question. You do not need a prescription. In 2016, the New Mexico State Legislature passed a standing order, meaning that anybody in the state, I think you need to be over 16 or 18 years old, can go to any pharmacy and ask for naloxone without a prescription. You do not have to have an opiate substance use disorder. You can get naloxone. It might cost you, a few dollars, but it can save a life. And if you have an opiate substance use disorder yourself, or you know somebody, having naloxone in your house or in your car is very important.
Very good.
Yeah.
Very good. Let me just say that I watched a video on YouTube
Right.
About a family that had trouble with their son.
Right.
And they made the mistake of throwing him out. Okay, you're addicted. You won't get off of this stuff. We don't want anything to do with you anymore.
Right.
It's really not the answer to most of these problems, is it?
Right. Unfortunately, what we need to educate is that addiction is a chronic disease. not at all different from diabetes, not different from arthritis. If we can kind of get the word out that addiction is a chronic disease, that sometimes patients have relapses and remissions, failures and successes, and that eventually most patients get better. And it's really in our best interest as a community and a society to help patients through their relapses. We'll all be better off.
Well, let me ask you, so that folks out there know, if they've been getting a pain reliever for
Right.
maybe lower back pain, shoulders,
Right.
a lot of shoulder problems,
Absolutely.
dental, even if
Right.
they got something from their dentist, and all of a sudden they think, wow, I kind of got to have this.
Yeah.
What should they do?
Right.
What should a person who
Right.
thinks they might be on this
Right.
drug?
The first thing that I would say, Don, is they should really go talk to if they have a primary care doctor, go talk to their doctor about it. If they don't and they feel more comfortable talking to their local religious figure, if that makes them feel more comfortable, or if they have a behavioral health care provider, go talk to someone they feel close to, or their spouse or their parent. Go talk to them about getting help. Help is available. There are many successful treatments now for addiction. There are medications that are available, whether it's methadone or Suboxone, naltrexone, combined with behavioral interventions. There are Narcotics Anonymous groups, so you don't necessarily have to take a medication. And you can get help for this, yes. And what we know about pain management is what we know from the Centers for Disease Control. The best practices for things like pulling a tooth out or minor surgery is not to give patients opioids right away, but it's to start with non-opioid medications. So we, as a healthcare profession, we can do a better job about preventing patients developing substance use disorder in the first place.
Okay. Now, I've been treated for pain a few times,
Yeah.
and the doctors are always asking me,
Yeah.
can you give me a 1 to 10?
Yes. Oh, yeah. Yeah.
Range
Yeah.
in your pain.
Yeah.
About how
Yeah.
high should
Yeah.
the number be before you give somebody
Right.
that kind of medicine?
Right. That 1 to 10 scale, that Likert scale, came into being about 20 years ago when the Joint Commission, is an agency that accredits hospitals all around the country. And I think the desire of the Joint Commission about 20 years ago was wanting to do a good job for patients suffering from pain. And so they wanted to make it, they called it the fifth vital sign. So the idea was to ask patients at every encounter, to an emergency room, to an ambulatory care appointment, every time your blood pressure and vital signs were taken in the hospital, to ask patients, what is your pain? But what happened was, that was happening right at the same time that Purdue and other pharmaceutical were just being developed and were being pushed to come out. So as OxyContin was just being released, and doctors were saying these medicines are not addictive, the Joint Commission was also saying we should prescribe pain medicines to get patients' pain down from 10 to 6 or 8 to 4. So it was like the perfect storm, if you will. And now we know that maybe pain should not be the fifth vital sign, and maybe we should ask patients more about how is your function, but less about is your pain innate, because for most patients that doesn't tell us a whole lot of information. It's probably better to ask patients, are you able to walk better on your medications? Are you able to play ball with your grandson? Are you able to walk around the market? But the pain score itself doesn't give us a lot of beneficial information.
Okay, well, thank you for that
Yeah.
information. Tell me, how is USDA helping you
Yes.
with ECHO?
Oh my gosh. Well, Arthur and Terry and Ernie, they've just been an amazing team. The USDA does so much for the health care of rural New Mexicans, whether it's for the, the, the rural health, getting ambulances, getting housing, getting mortgages, getting improving the intranet and internet facilities and increasing bandwidth. They really help. And how I have associated with the USDA has primarily been through Project ECHO. My work with Project ECHO is to teach clinicians how to take care of their patients. And that is how Art Garcia, through his leading the New Mexico USDA chapter, really reaches out, and I coordinate with him on many projects. And that's how we reach out to all the rural towns. And I think we complement each other in that way.
Very good. Let me ask you quickly. We want to put something on the screen now that will help people contact you. And
Absolutely.
what sorts of questions would you like to be able to answer for folks if they're going to use this information?
Right. I'd like patients. I'd like prospective patients from rural towns and even larger communities to be able to let their clinicians know that Project ECHO is a resource for their clinicians. That the clinicians can call Project ECHO whenever they would like to learn about a different clinical topic, a clinical subject, share a case presentation. We've got different topics like pain and addiction, rheumatology, bone health, hepatitis C, HIV, improving perinatal health, reproductive health, many things that where rural towns don't have the specialists. There's many specialists that are lacking all over the state. And I really think this could help, in concert with the USDA, could help rural New Mexico.
Okay, so this is the common viewer out there can suggest to their physician, would you contact ECHO and
Right.
ask them about my case?
Absolutely, absolutely. They can inform their clinician about Project ECHO. And there's also a wealth of information on the Project ECHO website for the patient themselves.
Okay, good. And Art, how do you feel about this? What sorts of things are you especially trying to do to help with the ECHO program?
Right, right. Well, first of all, it was most providential that we were able to find Project ECHO and partner with Dr. Katzman, and it's been a great synergy for us to approach these problems in rural New Mexico. We, communities need resources to deal with these issues, and in order to receive help from Project ECHO, we can support those communities so they can have better access in terms of bandwidth, so that their physicians can get online and talk with Project ECHO and their staff and their physicians. In addition, we support communities in terms of infrastructure. In Portales, we helped with the hospital here and building some of the hospital. Santa Rosa, the same thing. We provide rescue vehicles, first responders, fire trucks, police cars, ambulance, paramedic equipment. In House, New Mexico, we did the defibrillator. And so a lot of things that help Project ECHO to get the patient well. That's our interest. So we're very lucky to be working with such a fine group of people, and Dr. Katzman. I learned so much from her all the time, and it really helps us to do a better job in terms of addressing support for rural communities.
Well, this is great. What do you say to your to your people in Washington who contact you and say, well, how you doing down there in New Mexico? Do you tell them about ECHO and what you're doing
Well,
with ECHO?
they certainly know. Dr. Katzman and her group have been at the White House with Ann Hazlett, who addresses this in rural America all across the country.
Yeah.
And they have very serious discussions about approaches to patient care. And then last year, we held a roundtable that went through your system. I forget what the system is called, where it was broadcast out. And it talked about the work that they do and how we can partner together.
Right.
And so we've been getting the word out.
Right.
Yeah. And then being with here today with you, Don, really helps us.
Yeah.
Good. We're certainly glad to help
Right.
anytime that we can. And now let's go over one more time, though,
Right.
what we want people out there, just a general viewer, to know about pain relievers and to know about the dangers
Right.
of these pain relievers.
Right. So I guess the thing that I feel most passionately about is that pain relievers, meaning the opioid analgesics that are considered controlled substances, are very, very dangerous. They need to be prescribed from your primary care clinician or your doctor, and it might be a physician, it could be your nurse practitioner, your physician assistant, and it should just be one person. It should not be many different clinicians. So it should not be from different practices. And it should not be combined with alcohol, should not be combined with other medications called benzodiazepines, which are considered muscle relaxants. These benzodiazepines have different names. Some of them you might know of as Xanax or Ativan, Halcion, Ambien. And the reason being is because when you combine the pain relievers, the opioids, with the muscle relaxants, things like Xanax, you can have such a respiratory depression or such a problem breathing that you might fall asleep, so to speak, and not wake up. And this is what is called an unintended overdose death. You might not wake up, and this is why naloxone is so important as a harm reduction tool. And so this is what we educate about. Alcohol is frequently seen in combination with those two medications. So that's what I would say.
And we need to, we should all have some naloxone
Yes.
in the house, in the
Yes.
medicine cabinet.
Yes.
Don't be afraid of it.
Right.
Of course, keep any medicines out of the reach of children.
Right.
That's another thing.
Absolutely.
Boy, howdy.
Yes.
Pain relievers should be somewhere where nobody can get them but you.
Absolutely.
Yeah.
And then also be really mindful on the news that there several times a year there are take back days for your medicines that you're not using anymore. So whether it's your pain relievers or other drugs, you can take it back to police stations or the fire station.
So if you've got 5 pain relievers left, don't give it to your cousin Harvey.
No.
Take
Don't
it
give
to somebody who will.
Yes. Or crush it up and put it either in your coffee grounds or kitty litter and put it in a Ziploc bag and put it in the trash. And that's because that way no one else can get a hold of it.
Very good.
Yeah.
Very good. And that is great advice. You're a neurologist. People should see a pain specialist if they have pain that just keeps repeating itself, shouldn't they? I mean, that's who you are, the people they should come and see.
Yes, if they can, and if they can't, they can have their primary care doctor call one of our many echo programs around pain or addiction. They can help too. But seeing a pain specialist is definitely preferred.
Very good, very good. Always the doctor should be the final authority, not anyone in your family, not a cousin who recommends or your friend at work. Always go to the doctor.
Absolutely. Absolutely.
Okay. Well, thank you very much. And
Thank you.
we want the folks out there to know how serious this is. We want to stop this
Yes.
from happening.
Thank you.
It's good medicine, but it's only good medicine if it's used properly.
Right.
Okay. Well, thank you both very much. And
you.
Art, thank you for helping all of us know more about this and getting things out like ambulances and defibrillators out into communities to help with our health in our rural communities. I got to tell you, it's not easy for a guy my age living as far as I do from major expert doctors.
Right.
And so it's great what you're doing.
Thank you.
All right.
Thank you
Thank
so
you.
much. So appreciate it.